And a very good morning to you. It is Rhema, Brekky, Mick right in the chair with you. And it is that time of the month. We've had a little bit of a break. You probably have already heard. But our resident medico, Dr Clara Chu, is back in the studio with us this morning. Dr Clara, it is so good to see your face and have you back on board.
Yeah, it's great to be here. Thanks, Mick.
How did you spend your New Year's? Happy New Year, by the way, as well.
Yes, Happy New Year to you too. I spent the New Year going to bed early. Bit boring, but I wanted my sleep.
Hey, listen, that's what happens when you get over 30.
Yes, something like that.
That's what I like to say. That's my story, and I'm going to stick with it. Now, look, this month, of course, is February, and it is a very important month as well. It is called Red Feb, so it's all about heart health.
Yeah.
So when you're talking about heart health, it covers a huge range of things, but I think one of the most obvious things that we could probably talk about today is blood pressure and hypertension. So let's jump in this morning. Now, what is meant by BP?
Yeah, so BP stands for blood pressure, and it's the pressure of blood on the walls of your arteries as your heart pumps blood around your body. So in other words, it is the force that keeps blood moving through your arteries once it's been removed, out of your heart. Now, blood pressure readings can give you an indication of how hard your heart is working and are an important part of the general health assessment. So it's something that we can quite easily do without it being too interventional.
Sure.
Now, your blood pressure doesn't stay the same all the time. It changes to meet your body's needs, and it's actually normal for your blood pressure to go up and down throughout the day. So it's not actually a flat line. It's affected by various things like your posture, your breathing, your emotional state, whether you've been exercise and sleeping. We'll talk a bit more about some of these things later on.
It's very interesting to find out that, it does go up and down.
Yeah.
And all different factors. Now, how can people check that?
Yeah, so a blood pressure is usually measured with an inflatable pressure cuff that wraps around your upper arm. This cuff is part of a machine with a very complicated name that I'm going to try and pronounce.
Go for your life.
Called sphygmomanometer. I can't even get that right.
Look,
anyway,
you did better than what I would have, that's for sure.
Yeah, so our listeners can look that up and turn it into a tongue twister. So yeah, it is best to measure your blood pressure when you're relaxed and sitting down. And as I said, your blood pressure changes to, meet your body's needs. So for example, your blood pressure would be high if you're exercising. So, you're running or you're in an exercise class, and lower when you're sleeping. Because obviously the demand is not there.
Sure.
So if a reading is high, your doctor may measure your blood pressure again on separate occasions before diagnosing you blood pressure. Now, your doctor may also recommend that you have it recorded at home if you've got a blood pressure machine at home. Or if you don't, then we can actually organise through pathology a 24-hour blood pressure monitoring. So that involves measuring your blood pressure at regular intervals, usually every 20 to 30 minutes, while you're doing your regular activities. And you just basically borrow that cuff for 24 hours.
Sure.
It records all those numbers for you over that period of time and give us back a report of how your blood pressure is looking when you're out there in the regular world. Because as we know, some people have a thing called white coat hypertension, where whenever they're in the presence of like a medical person or a pharmacist or a nurse, or even just in a hospital setting or a clinic, their blood pressure artificially inflates.
Yeah.
And so in the outside world, their blood pressure is perfectly fine. But if you always went off their blood pressure reading, under medical care, then you'd be thinking, hang on a minute, this person has high blood pressure, when actually they don't.
Yeah, that is a super, super important point, that one too. Now, what do the terms systolic and diastolic mean?
Good question. Okay, big words. So blood pressure is recorded as two numbers, one over the other. So for example, we'll say 120 over 80.
Right.
And this is measured in millimeters of mercury because that's the way that blood pressure is measured. So the first number relates to the pressure when the heart pumps blood into the arteries. So that's the systolic. And the second number is the pressure in the artery when the heart is relaxed. So that's called the diastolic. The higher the numbers, the harder your heart is working to move the blood through your arteries.
So what constitutes high and low BP? Because this is something that we really need to take notice of this morning.
Yeah, so I would imagine that quite a lot of our listeners would have some issue with blood pressure or know people with some issue with blood pressure. So let's start with high blood pressure. So high blood pressure is also known as hypertension, and I love digging into the meaning of words. So hyper means over or beyond, and tension means stretching or straining. So with hypertension, your blood pressure is permanently abnormally high, causing a strain on your blood vessels. And so in order to define what is high blood pressure or hypertension, we also need to know what is normal. So a normal blood pressure reading would be a systolic blood pressure of under 120. So that's the high number over 120.
Sure.
And then the diastolic blood pressure under 80. So that's the lower number. So we want it to be less than 120 over 80. Now, anything that's higher than these normal parameters would be considered high blood pressure. And the reason we care about blood pressure is because it's one of the main risk factors for heart disease, especially heart attacks and strokes. Now, there are no obvious signs or symptoms of high blood pressure. So you may not know that you have it. Now, there are some symptoms and we can talk about those, but for a lot of people, there are none. So this is why it's important to have regular checkups and measure your blood pressure and also learn what you need to do to manage it.
Sure.
Now, let's move on to low blood pressure. Low blood pressure is less of an issue. It's medically known as hypotension, with hypo meaning under. And that's when your blood pressure is below 90 over 60. So that's a medical definition. This doesn't necessarily mean that there's a problem. In fact, people with low blood pressure tend to live longer than those with high or even normal blood pressure.
Wow, that is very interesting indeed.
Yeah.
Now, what are some of the factors that contribute to high blood pressure?
So there are a number of things that can increase your chances of developing high blood pressure. So they include obviously your age and your sex, your family history, including your race or ethnicity or genetics, your eating patterns. So, if you're eating lots of salty foods, that can cause issues. Alcohol intake, smoking, carrying excess weight, and your physical activity or exercise level. So, and your blood pressure can, of course, also go up temporarily due to stress, your emotional state, whether you've been exercising recently, caffeine consumption, or even just as you're talking.
Sure.
Yeah. And then in terms of low blood pressure, there's a lot of different causes. Of course, when it comes to things like, losing blood volume, like trauma and things like that, those are very specific and special circumstances.
Right.
But in everyday life, when we talk about people who are walking around and, just feeling like they're feeling a bit dizzy or faint, that can be from emotional stress or fear or pain, dehydration, because that decreases your blood volume, and then your body's reaction to heat. And because when we get hot, our body will naturally pull the blood to the skin or out of the skin rather, so that can lead to dehydration. And, something obvious would be something like blood donation. There are a few other things, but, that's a very long list, including things like, traumas and losing blood from somewhere and all those kind of things.
Totally. Now, what are the risks associated with high and low BP?
Yep. So let's start with high again. So persistent high blood pressure can increase your risk of some serious and potentially life-threatening health conditions. So these include things like general heart disease, heart attacks, strokes, heart failure, because your heart's got to work a lot harder to pump the blood around, peripheral artery disease. So what we mean by that is the arteries in your legs most commonly, can become inflamed and, can become hard and not function properly. You can have issues like aortic aneurysms, which is where there's kind of like a ballooning of the aorta, which is the main artery, that supplies blood to the lower half of your body. Kidney disease and vascular dementia. So vascular dementia is a different type of dementia. We talked about dementia in the past, but it's specifically caused by damage to the blood vessels that deliver blood to the brain.
Right.
So, there are a number of alarming things there that you definitely, would not want to have on your medical.
Always good to get it checked.
Yeah, on your medical records. And as for low blood pressure, some of the complications are things like falling or fall-related injuries due to dizziness or fainting. You can also get heart problems or strokes. This is because low blood pressure can cause your heart to try to compensate by pumping faster or harder. And over time, that can cause some permanent heart damage or even heart failure. And of course, if the blood isn't flowing around as it should, then clots can form and you can end up with a DVT or end up with a stroke.
We are speaking this morning with our resident medico, Dr. Clara Chu. It is Red Feb, and this morning we are having a look at blood pressure. Stay with us. We'll be right back. This is Rhema Brekky. Welcome back. It is Rhema Brekky. We have our resident medico, Dr. Clara Chu, in the studio with us this morning. Very, very important topic. Again, we are talking about blood pressure in conjunction with the month of February. It is Red Feb now. Clara, can lifestyle changes help our BP?
Absolutely. As your listeners probably know, my favorite topic. And there's plenty that everyone can do to improve their blood pressure using lifestyle. So the first is to exercise regularly. In a study from 2016, it was found that regardless of the characteristics of the participants and the type of exercise that they were doing, there was a reduction in blood pressure in the hours following an exercise session. And this can actually persist for almost 24 hours after that actual episode of physical activity. So that's pretty significant. And a number of other studies have also consistently shown that there's beneficial effects of exercise on blood pressure, with reductions in both the systolic and diastolic blood pressure as much as 5 to 7 millimeters of mercury. So 5 to 7 of those numbers that we were talking about before, in those with high blood pressure. So if you want something free that will lower your blood pressure, regular physical activity is the way to go. Now, food always comes up. So in terms of food, we obviously recommend a healthy diet, plenty of fruit and vegetables, natural foods. There has been a study and a set of diet out there that's specifically designed for high blood pressure. So it's called the DASH diet. So that's DASH, which stands for Dietary Approaches to Stop Hypertension. So it was developed about 20 years ago. And it has been shown to be very effective in lowering blood pressure without the use of medication. So it emphasizes the consumption of fruit, vegetables, low-fat dairy products, whole grain, fish, chicken, nuts, and we want our patients to reduce their fats, their red meats, their sweets, and their sugar-containing drinks and those kind of things. It has reduced levels of total fat, saturated fat, cholesterol, and increased level of potassium, calcium, magnesium, fiber, and protein. So they've done a fair bit of work on this diet, and it's pretty well known as something that you can just, our listeners would be, most welcome to just look it up online, and they'll find plenty of literature about it. Another way to lower your blood pressure is to reduce your salt intake. So sodium or salt encourages your body to retain fluid. And by increasing that fluid volume in your bloodstream, that's what can increase your blood pressure. So there was some recent research that was published in the Journal of the American Medical Association, and they found that people following a low-salt diet for just 1 week can get significant reduction in their blood pressure compared to a high-salt diet. So both the DASH diet and reducing salt intake in general can be quite helpful. Last couple of things that can help you lower your blood pressure is weight loss if you are carrying excess weight. In general, blood pressure might go down by about 1 millimeter of mercury with each kilogram of weight that you lose.
That's a significant amount. If you lose 20 to 30 kilos or whatever, if you're quite overweight, then that's a huge number, huge change in your BP levels. Yeah,
absolutely. And that can bring you down from, needing blood pressure tablets to being well in the normal range. So, that's definitely, something that people out there can be aiming for. Limiting alcohol consumption. So there's studies that have shown that a reduction in alcohol intake is effective in lowering blood pressure in both people with high blood pressure and normal blood pressures, and may actually help to prevent the onset of high blood pressure as well. So heavy drinkers who cut back to moderate drinking can lower their systolic, so their high number blood pressure, by 2 to 4 millimeters of mercury, and their diastolic by 1 to 2.
Sure.
So, drinking less is also helpful.
Yeah.
And so, heavy drinkers who want to lower their blood pressure should reduce how much they drink over 1 to 2 weeks and not do it too suddenly.
Right.
And everyone knows, quit smoking if you are still a smoker.
Yeah, it's probably the biggest one, isn't it, really, the smoking?
Yep.
I mean, the research is already out there. The science, I guess, what they would say, it is confirmed.
Yeah,
So,
for sure.
smoking, not a good thing to do. Now,
No.
how common are blood pressure issues in society?
Yeah, so the data we have for this is from the Australian Institute of Health and Welfare. It's a few years old, but I reckon they're still pretty accurate. So in 2017 to 18, based on some data that they had from the National Health Survey, there are a few things that we know. So firstly is that an estimate of 34% of adults had high blood pressure. This included 23% who had uncontrolled high blood pressure. So that's, high blood pressure without medication. And then there's 11% whose high blood pressure was controlled with medication. Men were more likely to have uncontrolled high blood pressure than women. So that's 25 versus 20%. And then thirdly, the proportion of adults with uncontrolled high blood pressure increases with age. So, it starts with about 7.5% amongst 18 to 34-year-olds to a peak of about 47% at the age of 85 and over. So, that's a substantial, proportion of the population that has this issue.
Yeah, absolutely. Now, who is most likely to be affected?
Yeah, so men are more likely to develop high blood pressure throughout middle age. But then in older adults, it flips around. Women are more likely than men to develop high blood pressure. And so women who have high blood pressure during pregnancy are also more likely to have high blood pressure later in life.
Yeah, that's an interesting correlation for sure.
Yeah.
Now, what sort of medications are available to help with blood pressure?
Okay, so here comes some
It's a big one.
some big fancy names. And so the most common blood pressure medicines are called ACE inhibitors, which stands for angiotensin converting enzyme inhibitors. I don't expect our listeners to know what that means exactly. There are also angiotensin receptor blockers, calcium channel blockers, diuretics, beta blockers. Many people actually need more than one medicine to bring their blood pressure under control. So it's actually not uncommon for our blood pressure tablets to be in a combination form where there's sort of like two things combined together. So it might be like an ACE inhibitor combined with a diuretic. And so, that's pretty common. Look, the main thing to say about medication is if you've already been diagnosed with high blood pressure and taking medication, please make sure you have a regular blood pressure check, either yourself or at a chemist or at the doctor's. If these readings aren't in the optimal range, have a chat with your doctor and see if any of your medications need a change in dose, or maybe you need to try a different blood pressure medication or even add an extra one.
Sure.
What I say to my patients is, look, if you're already paying money for your blood pressure tablets, you might as well make sure that they're doing a good job and lowering your blood pressure adequately. So if we need to change your tablets or, rejig the dose or whatever it is, so that you get the most benefit out of them, let's do that. Because otherwise you might as well not be on them.
Yeah, and whatever you do, don't stop taking them.
No, absolutely not.
That is the big thing to remember.
Yeah.
Now, obviously with BP, can you live this is one thing that people will really be wanting to know. Can you live a relatively normal life if you are struggling with BP issues?
Yeah, Mick, interesting question. Now, that depends on whether you're aware of having high blood pressure and are treating it, or whether you have no idea that you've actually got hypertension, right? Because high blood pressure can quietly damage the body for years before symptoms appear. So, you could be living that very normal looking life and then things start to get to that tipping point and symptoms start to appear. So, if we know that people have been had high blood pressure and it's untreated for years, this can lead to like disability, poor quality of life, even a deadly heart attack or stroke, or something like the vascular dementia that I mentioned, that can result in sort of like a bit of a loss in memory and feeling confused and those kind of things. But on the other hand, if you know you have high blood pressure and you're either making lifestyle changes or taking medication for it, then there's a good chance that you just live a relatively normal life, provided that your blood pressure is under good control.
Yeah, and that's probably the thing to remember too. It's not just about taking medications and then going, oh, okay, I'm cool.
Yeah.
why wouldn't you then change your lifestyle habits as well as kind of a two-pronged attack?
Yeah.
Maybe also get some exercise in there as well. Maybe you haven't exercised in the past, but doing a whole lot of other things in conjunction with your meds will go a long way to change that. For sure. Now, something I wanted to ask you before too, Clara, was, with BP, somebody gets a diagnosis of high blood pressure and all of a sudden, they could throw them into a panic mode, like, oh my gosh, I've never had high BP before, and how long has this been going on? What is, what sort of time frame are we looking at here? This is not like, over a couple of months. Are we looking at a few years? Are we looking at decades possibly for things to really start, I guess, be pronounced with their health?
Yeah. So, most of my patients, if they've been diagnosed with high blood pressure, we start to pick up that the blood pressure's high. Mm-hmm. The rest of their health is generally fine. Their heart's functioning fine. Their kidneys are filtering their blood okay. Their brain's still working perfectly well, and the blood, everything's still kind of like chugging along.
Yep.
But obviously your heart is working harder over time. Your blood vessels are hardening over time. We're talking about micro damage to, your eyes and all sorts of other things. But this is something that takes, decades.
Sure.
Now, just because it takes decades doesn't mean we go, oh, well, it takes decades. Let's not worry about it. I'll be fine. I think that, because something takes decades, there's more of an urgency to actually fix it and to give yourself the best chance. Yeah,
and you've also got plenty of time then too to be able to, I guess, pull back, a lot of that kind of that damage that's going on through medication, through your lifestyle changes and different things like that over a long period of time too.
Yeah, absolutely.
Which is what we want. Now, to wrap us up this morning, what sort of support is available if people are out there listening in, they're struggling with high or even low blood pressure?
Yeah, there are some excellent websites and apps that provide really good information. So the Heart Foundation and Health Direct both have a page on their website that's dedicated to high blood pressure, so good places to go for some general information. For those who'd like to make some dietary modifications, the George Institute has a page on their website and an app called Food Switch. Mm-hmm. And so this app works by using a mobile phone camera, scanning the barcode of packaged food, and then it uses some science-based algorithms to calculate and display the simple nutritional profiles in the food and tell you, what to replace things with. Mm-hmm. And so there's a version that's specific to Australia, available on both the Android and the Apple platforms. So that's something that, listeners might be willing to look into. And then the last thing that people might want to look up is the DASH diet, which we talked about earlier. That really can be quite comprehensive if you wish to lower your blood pressure through natural, dietary means. And then, of course, speaking to your GP, they'll be able to answer your questions and, assist you with any concerns that you've got.
Yep, absolutely. That's great. So much good information there, guys. So make sure you have a listen to this one again back on the website and also on the YouTube page as well. This will be on there. Make sure you share it far and wide as well. This is a big, big, big topic that we're talking about and can often be called the silent killer.
Yeah, absolutely.
Out of control, high or even low BP over decades can really take a terrible toll on the body if they're not reeled in quickly. Now, Clara, before I let you go out of the studio this morning, you've got a couple of great seminars coming up throughout the year, and we will be talking about those things at a later stage. Now, coming up probably in the next couple of weeks, I think you've got one of these ones popping up. What's it about?
Yeah, so at Life Medical Centre in Erina, we believe in educating our patients on various health topics. Mm-hmm. And one of the ways that we can do that rather than just one-on-one appointments, which is quite labour intensive, is that we actually give these things called group medical talks.
Right.
So on February the 15th, which is a Thursday, I will be giving a talk on osteoporosis and bone health. So, yeah, if anyone would be interested in coming along and having a listen and, finding out more about how they can look after their bones and how to prevent or improve, their bone health or prevent osteoporosis. Give us a call, visit our website at Life Medical Centre in Erina.
Brilliant. As always, look, great to have you back in the studio for 2024. Looking forward to the rest of the year. We've got a whole lot of great health topics coming up as well. Dr. Clara, thank you so much. This is Rhema. Brekky, stay with us. Well, more after this.